Sleeplessness or insomnia is a sleep disorder characterized by difficulty falling or staying asleep or waking up too early and being unable to fall back asleep. There are several approaches to treat insomnia, including non-medical and medical treatments. First, we will see how to treat the insomnia naturally or non-drug treatment for insomnia. First, to educate the patient to adopt a lifestyle that promotes good sleep. Have a regular exercise. Avoid strenuous exercise close to bedtime. Avoid large meals and limit fluid intake in the evenings. Use the bedroom for sleep and sex only. Establish good sleep hygiene. That means a routine for winding down, going to bed and preparing for sleep. Avoid alcohol and caffeine containing beverages close to bedtime. Avoid distracting stimuli at bedtime, such as loud noises, bright lights when not being used therapeutically, and extreme temperature variations, and ensure a comfortable and quiet environment for sleep. Try some relaxation therapy. Next is stimulus control treatment of sleep. By go to bed only when you sleepy and to get out of bed if sleep is interrupted. Try visual or auditory biofeedback therapy that teaches the patient to control specific physiologic factors such as muscle tension. Try autogenic training. Imagine a calm environment with comforting body perceptions such as warmth and heaviness of the limbs. Try imagery training. That means focus on pleasant images. Try hypnosis, meditation, yoga, abdominal breathing, progressive muscle relaxation from the feet up to the facial muscles. Next, we will see the drug treatment for insomnia or sleeplessness. The first drug of choice is benzodiazepines. This class of medications, which includes the drugs such as diazepam and diazepam. Diazepam, the famous brand name is Valium. Diazepam, the famous brand name is Restoril. These are central nervous system depressants that can help with sleep. Benzodiazepines works by enhancing the activity of neurotransmitter GABA, which promotes the relaxation and reduces anxiety. However, benzodiazepines are habit-forming drugs and should only be used for short-term treatment of insomnia. Habit forming means there will be a possibilities of addiction of diazepam and diazepam. Then next we will see the dosage of diazepam. The diazepam dosage is 5 to 10 mg taken orally at bedtime, while the usual adult dose of diazepam is 15 to 30 mg taken orally at bedtime. The next class of drugs are non-benzodiazepine hypnotics. So this class of medications, which includes the drugs such as zolpidem, the brand name is Ambien, and ezobiclone, the brand name is Lunesta, work in a similar way to benzodiazepines but have a different chemical structure. They are also used for short-term treatment of insomnia, but they do have a lower risk of dependence than benzodiazepines. That means the addiction itself having only lower risk of dependence or addiction. when compared to the benzodiazepines. The adult dose of zolpidem for insomnia is 5 to 10 mg orally bedtime, while the esopiclone dose is 1 to 3 mg orally at bedtime. The next group of drugs are melatonin receptor agonist. The drugs such as ramelteon, that brand name is Rosorem, and tasimelteon, the brand name is Hedlios. These drugs works by binding with melatonin receptors in the brain, which regulates the sleep-wake cycle. These melatonin receptor agonists are used for the treatment of insomnia in individuals with circadian rhythm disorder. The dose of ramelteon is 8 mg orally bedtime, and the dose of tasimelteon is 20 mg orally at bedtime. Finally, orexin receptor antagonist. The drug name is suvorexant, brand name is Belsomra. It's working by blocking the activity of orexin, that is a neurotransmitter that promotes wakefulness. So orexin antagonists are used for the treatment of insomnia and may have a lower risk of dependence than the other medications. So they have a very low risk of dependence or addiction when compared to the other insomnia medications. So this is about the treatment of sleeplessness or insomnia. If you like the video, please click the like button and subscribe to our channel for more videos. Thank you.